It's your call with Terry Baxter. 01473 212121.
To our top story then, an Ipswich woman says Suffolk's mental health service is failing people when they're in crisis. Figures obtained by BBC Radio Suffolk from the Norfolk and Suffolk Mental Health Trust show that the number of their patients who took their own lives last year was almost twice that of 10 years ago. There were 7 suicides in 2003 compared to at least 13 in 2012, although it is down on 2007 when there were 21 deaths. The Suffolk User Forum, who supports those using the services, have told BBC Radio Suffolk the figures are too high. Earlier, we heard from Sally Ann. She lives in Ipswich and suffers from severe depression. She says she feels let down by the way she was treated by the Trust. You may find this report upsetting.
My first experience of the crisis team was a very interesting one. I was absolutely desperate. I was in floods of tears. The emotions were just so overwhelming. I rang the crisis team, first time I've ever done it. It's a big thing to do when you are in need to actually reach out. I said to them, I'm sitting here with a razor blade and I am desperate, and I was told to take my evening medication, to have a hot drink and to watch the television for distraction. After the phone call, I then went up to the bathroom and slit my wrist. I wasn't consciously thinking that I want to die. I just knew that for that time I needed the overwhelming emotional pain to stop. And the only way that I could do it was by cutting myself. The only reason that I stopped was with the loss of blood. I began to faint, and I didn't want to faint. I wanted to be dead.
How did you feel afterwards about the way that you were treated by the crisis team?
I was so frustrated, let down, angry. The woman had absolutely no idea at all of how to talk to me, of what I needed. And from listening to other service users, that does seem to be what they do. All I needed was a gentle, soothing voice just to stay with me until the desperateness had passed. They couldn't do that.
How do you feel about the Trust now? Do you feel supported by them?
No.
That's Sally Ann. We also heard from Jane Davey from Suffolk's independent mental health charity, the Suffolk Users Forum.
Service users have recently expressed quite negative feelings about the crisis team. I think there's a gap between what the crisis team sounds like it provides and what people's expectations are. So crisis team seems to imply that somebody will have a responsive outcome to their call to the team that's going to support them and help them through a very difficult period where they feel very suicidal. But I think actually what happens is the crisis team have a very kind of, I guess they're trying to give a calm approach. So they will advise people to go and have a cup of tea, go and take a walk, or go and have a hot bath. But when people are actually in that moment where they're feeling very suicidal, where they're feeling they're going to take an overdose if they go to their medication cupboard and take the next drug to calm them down, or where they feel they're going to slit their throat or their wrists, I don't think it's really what's meeting their needs. And when we had a meeting a couple of weeks ago with the crisis team managers, there was also a gap between what the managers thought staff were providing and what staff actually seemed to be providing. It also came up that there really wasn't that much in-depth training about managing people in crisis. So I still think there's a gap there in terms of meeting people's actual needs on that day. There are some people with certain conditions who regularly experience suicidal thoughts quite significantly. And there's one lady, and I know she won't mind me talking about it today, who phoned up the crisis team in the middle of the night saying that she was feeling so bad she wanted to take an overdose. She knows she needed to take a drug called lorazepam to help calm her down, but she was frightened if she went to the drugs cupboard in her kitchen that she would end up taking everything that was in the cupboard. The crisis team said, well, we'll talk you through the process. But even as they were talking her through it, trying to support her on the phone, she actually ended up taking the whole lot and ended up taking an overdose and ended up feeling very unsupported.
Jane Davey from the charity Suffolk User Forum talking to our reporter Natasha Malcolm-Brown. Listening to that is Hadrian Ball, who's the Medical Director for the Norfolk and Suffolk NHS Foundation Trust. Good morning to you.
Good morning.
Thank you for joining us. It doesn't make good listening, though, does it?
Well, I mean, firstly, I'm very sorry if some of our service users have not sort of experience the sort of care that they would expect from our crisis team. However, what I would like to say is that overall, the performance figures that we have for our crisis teams right across the Trust indicates that they are performing to a satisfactory level. And secondly, I'd just like to say something about the role and the purpose of crisis resolution. Crisis resolution is something that shouldn't be seen in isolation. It has to be seen in terms of the overall care, the longitudinal care provided for an individual service user. Yes, its purpose is to provide an emergency response at times of crisis, but it's also there to ensure that the response is an appropriate one.
Well, we're talking about.
And if I can just finish, and it's also intended to enable service users to continue to remain in the community and to receive their care at home whenever possible.
Okay. Some issues then with what you've just said. Firstly, satisfactory level, operating at a satisfactory level doesn't sound very satisfactory if you were Sally Ann or the other lady that Jane Davey described. So that must give you concern.
Yeah. Firstly, I'm always concerned about healthcare. It's our job.
Well, I'm concerned when I hear these sort of stories. I think most people listening to it will be concerned also. But perhaps you're in a position to do something about it.
We continually monitor our services with the purpose of looking to improve those services. It's very difficult for me to comment upon any individual case, but if I'm provided with the details afterwards, then individual cases can be looked at through the usual route.
Okay, but let's broaden this out then. If somebody actually phoned the crisis team and said, "Look, I'm feeling absolutely desperate here. I have a razor blade, and I'm really feeling that I'm going to do something that I shouldn't." Sit down, have a cup of tea, and take your medication. Is that the sort of level of care that they should expect from the crisis team?
It is very
sort of level of care you might expect from a neighbour, perhaps.
It is very difficult, and in fact, it is impossible to provide a generalised response to a scenario like that. As I said earlier, crisis resolution has to be seen in the context of the longer-term care plan for an individual service user. The professionals who work within crisis resolution teams, they have the information and records available of individual service users, and their response is shaped by the crisis plan that is in place for a service user.
Or perhaps should be. Yeah,
yes, it should be.
And isn't always. I mean, Sally Ann saying, but anyone might. I'm broadening it out because I take your point about individual cases. It is difficult, but if anyone was calling and they were in that situation, you might hope to have a gentle, soothing voice to try and see you through that moment of crisis.
Yes, you would. One would expect the professional dealing with that case to deal with it professionally and sympathetically. That is the case. Yes.
The Suffolk User Forum actually suggested that the discussions they'd had led them to the impression that managers within your service had a different impression of the service that was being provided to your patients than those who are delivering it. That's got to be an issue of concern for you as medical director.
Yes, as I said earlier, I'm always concerned. Firstly,
if your managers don't know... You can.
Let me finish.
Providing you keep to the point, Hadrian, because the point is, if managers don't know what your staff are doing, that's got to be of concern.
Again, I think this has to be seen and understood in context. Firstly, I am very pleased to hear that managers of services are having direct contact with service users and service user representatives. The input of such people is invaluable, and it's necessary to ensure that we maintain and improve the quality of our services. And that sort of contact goes on right across Norfolk and Suffolk NHS Foundation Trust, right across the services. So the fact that that contact has taken place, I assume that the service user representatives passed on that information to the managers, and that information will then be used to evaluate the service and, where necessary, ensure that steps are taken to improve the service.
Okay. Do you believe, as medical director, that your staff who are delivering crisis help have a lack of in-depth training?
No, I don't believe they have a lack of in-depth training. But what I do know from my long experience as a medical director, but also as a consultant psychiatrist as well, is that the practice of mental health, the practice of psychiatry, is very difficult, and it can be difficult to ensure that assessments around risk, for instance, are always accurate and always well informed. And the Trust has put in an awful lot of resource in terms of training for risk assessment, and this is a particular area where even more training is required. And the picture in terms of what is happening in Norfolk and Suffolk NHS Foundation Trust in respect to things like risk assessment, suicide prevention, is exactly the same as what one would find in other services across the country.
Some concern being voiced, Hadrian, that since we've had the merger of the two trusts, Norfolk and Suffolk, that Suffolk's the poor relation. Would you refute that?
I would refute that.
You don't sound that convinced, actually.
No. I do. I am convinced. I do refute that. Absolutely. Following the merger in January 2012, the board structure changed. There was a dedicated executive director put in place for responsibility for the operational management of Suffolk. Additional non-executive director input from Suffolk was also provided, and indeed our new chair is a resident of Suffolk as well. Okay. And I would also like to add that the input and the contribution that has been made to the wider merged trust by leading mental health professionals in Suffolk has been enormous and has contributed to the development of the trust in a major way.
Okay. Well, look, we appreciate the fact that the service is there, and at times of need, people need it, but we just need to make sure that it is fit for purpose, don't we? Thanks for joining us.
No. I think it's. I'd like to thank you for raising this as an issue. I think it's very important that any concerns about mental health, in particular, and about our services are raised in a public forum. So, thank you very much.
Thank you for joining us, Hadrian Ball, who is the medical director for the Norfolk and Suffolk NHS